Choice 106.9 FM, along with 980 AM, WRD, your great Pensacola, and on the World Web at www.wrd980.com. It's time now for You Got the Power with your host, Omar Neal, live.
Well, thank you, Bob, and welcome again to the You Got the Power show. I am your host, Omar Neal. Before we get into the show, I want to first of all tell you about how appreciative I am that all of your phone calls, all of your emails, all of your texts, all of the messages on Facebook for the loss of my mother is hardening. I've not gotten a chance to talk to many of you because it's been I've been so inundated with calls, but I promise you, once we get through this process, I will call everyone back and make sure that I respond to every person who reached out to me. I promise you I'm going to do that. But thank you so very much for everything. It is what is bringing us through this very difficult and challenging time in our lives. Well, you know, we got to keep doing what we're doing. And so I want to bring up something that's critically important, and that is making decisions based on science, not politics, when it comes to engaging our children and even any institution in the normatization of going back in the physical realm. I have two people to whom I hold at very high esteem, Dr. Roby, who is a PhD, as well as the Associate Professor and Associate Chair of the Department of Health Policy and Management at the University of Maryland. And then I have Dr. Tonya Chestnut, who just won the Democratic nomination for the 5th district of the Alabama School Board. Now she's not yet there, but hopefully in prophetic words, in November she will win that and will be seated on the school board. 17 counties that she will be representing. And so I have both of them here, as you can see, and I'd like to welcome both of you to the You Got the Power show.
Thanks for having me.
Glad to be here.
Let me start with you, Dr. Roby. I know that you have done some research on what protocols and what to look for and how to really process this notion of safely re-entering. And that's something that, because many school districts and many businesses are just kind of flying by the seat of their pants. They don't have a Dylan Roby in their community. And so I wanted to share you and your work with my listening audience. Tell us first of all, what is the scope of your work? What is it that you've done? And then we'll talk about how it can be applied to places that I'm talking to.
Sure. So my focus is in health policy and health reform, and really looking at how government can enact policies to improve health insurance coverage and improve health outcomes for everyone. So I think that comports pretty well with the COVID pandemic in that we have gotten very limited guidance from the federal government about what is acceptable in terms of disease control and kind of the public health side of things. And one concern I've had since March relates to the changing guidance over time and how we've gotten mixed messages about what the public health evidence points to, in addition to what we can do to mitigate spread of the disease.
Interesting. Dr. Chestnut, we had a conversation a few weeks ago, and, this notion of each county, each school board, each superintendent making those decisions without any strict guidelines or established guidelines seems to be a little dicey. We see that the University of North Carolina opened school and now having to close school again because this notion of social distancing and young people seem to be an antithetical concept. How is Alabama faring now, and what do you see as the pathway to us remedying this issue of science versus politics?
Well, personally, I believe that every decision that's made should always put lives over livelihood. And I'm very concerned. I was watching the news just the other day where the situation in Tuscaloosa with the University of Alabama students not taking the pandemic seriously. And there was a plea from the mayor, video of students not wearing masks, not social distancing. So we have a population that really seems to think that nothing is going on, or their actions give one the thoughts that this is not real. We're in a situation that is very alarming and very concerning, because in most instances where the students have gone back to school, we're seeing an outbreak of COVID. And so, you know, at some point, we have to, even though we say we're concerned about the lives of our children and employees, then our decisions need to align with our conversation. And so Alabama is in a situation that if we're not careful, we will be a repeat of what took place in North Carolina. However, many of the school districts are taking the virtual option the first 9 weeks. The concern now is what will take place after the 9 weeks. And of course, as a candidate for state school board in a District 5, is a very high poverty area. My concern, of course, is about the kids that may or may not have accessibility to internet, those kids that are already challenged academically. There are so many variables, even beyond the health challenge, that we are facing here in Alabama.
Yeah. You know, Dr. Roby, you know, I sensed a degree of frustration with you, because it's like, you know, we knew that if something ever were to take place like COVID-19, with all of the health disparities, we knew that the outcomes would not be good. You've been looking at this for years. And with comorbidity, the lack of insurance for certain segments of our population, all of these things conflated would create negative outcomes. So is that kind of, did I sense this right when I heard you speak first?
Yeah, absolutely. I think, you know, the evidence has pointed to airborne transmission of COVID and a disease that has a disproportionate impact on lower income folks, people who are likely to be essential workers, who are in already underrepresented, underserved minority communities. And what we're seeing just exacerbates those problems. And it's not, right now, it is not a disease of upper class whites, because they are able to stay at home and work from home remotely and buy masks, and they don't have to go make, you know, and they use delivery services for everything they need. And so the double standard we have around reopening impacts communities of color and communities in poverty much more than it does higher income and white populations. And I think one of the big problems I've had throughout this pandemic, in addition to having a 2-year-old at home, is trying to figure out like what the federal government is actually saying and what they are signaling in their guidance. So for example, early on, everybody was told, oh, wash your hands and you'll be fine. You should not be wearing masks because that'll increase your likelihood of catching it because you'll touch your mask too much, or you don't know how to doff your mask appropriately. And what it turns out is they were trying to get people to avoid buying the PPE, the personal protective equipment that medical workers needed. And so we had the Surgeon General explicitly saying, don't worry about wearing a mask, just wash your hands. And now we have converted to a world in which wearing a mask is the most important component and people are overly concerned about spread via surfaces, and people are having a very difficult time trying to figure out who to trust and what information to use from their government and different entities that are providing information. And that's a recipe for disaster when it comes to public health messaging and making sure people know how to protect themselves. And then at the same time, we have these issues with shortage of testing, inability of the federal government to procure supplies, competition with states to procure supplies, and causing governors like Governor Hogan in Maryland to do a stealth operation to get tests imported from Korea. So like the government mismanagement of this problem has been very troubling to me.
You know, it's interesting, Dr. Chestnut, you know, when Dr. Roby said that this mismessaging can really confuse people and people don't know what to do, which literally can exacerbate the problem. Do you find that there's any clear-cut messaging and protocol established, as you understand it, in the public school system in Alabama?
Well, the situation that we're running into in Alabama is that every school district was given the option to make their own decision. And so there's no continuity across the state. You have some school districts, as I said earlier, that are going back into the schools, and you have some that have made the decision to remain remote. He is exactly right. There seems to be inconsistency and just no clear-cut vision of which direction to go. You have those that are doing everything that they can to prevent the spread of COVID, and then you have a population of people that are pretending as if nothing is going on. And it's really putting us at a disadvantage, especially here in Alabama. We already have challenges academically. And so my concern as a candidate for state school board is, will our students be able to recover from this break in service? You know, will they still be able to maintain the level of instruction? Will the academic needs be met? Not to mention the physical challenges that we will probably face once those students go back into the classroom.
I want to stay with you a second, Dr. Chestnut. Dr. Roby said that we know that it's disproportionately impacting communities of color, low-income people. Do you believe in, and I don't really, you know, you're in politics, I don't want to harm you there, but do you believe that maybe we would be looking at this differently if other groups were more impacted than people who are marginalized and disenfranchised already?
Well, personally, you know, I do wonder, you know, if there will be a different perspective. I am quite concerned about the disproportion of lower income African-American people being impacted by COVID. And so, you know, it just leaves one to wonder, I'll put it that way. It leaves you to wonder whether or not it would have the same look if it was another way.
You know, it's interesting. I'm not gonna put that on you. I'm gonna say it. It would absolutely, unequivocally be different if different people were predominated this conversation with this impact, and I can say that unequivocally because I've seen how when certain things happen to certain communities, they become very expeditious in addressing those issues in a more deliberate way than not. Let me ask you this, Dr. Roby. Do we know what to do? Does anyone know what to do? You just talked about the Surgeon General who you know, you said that he said it because he was trying to preserve the PPEs, right, for the medical industry, right? I mean, do we really know what to do? Or are we just guessing at this because in that this particular disease is so new to us?
So I think to an extent we know what is effective in mitigating spread. We don't know what to do to get rid of the disease completely. There is limited evidence that, well, there's really no evidence that you can get this from food or from touching surfaces that other people have touched potentially, although there is inactive virus potentially, or even active virus in samples that have been taken in those environments. It's usually not enough to trigger an illness or serious illness. And so what we're learning now is more about the level of exposure and how you can get it. And so before we were told, well, it just matters that droplets in the air may carry the disease. And what's coming to light is that those droplets do end up turning into aerosols, and they do hang around in the air for a longer period of time, especially indoor. And if inhaled, those, or they go into your nasal cavity or what have you, those will potentially infect you. They can also come into your eyes. And so the fact that it's basically airborne through aerosols is really important. That means we have to focus on things like ventilation and group housing, in dormitories, in buildings where people are working. But it also means we have to think about how to ensure that people are protecting themselves using face shields, masks, etc. We also know, it seems from existing evidence, that viral load is really important. So the amount of virus you inhale or get in your nose or eyes is really important. And so if you're wearing a mask, you potentially would get less virus in than somebody not wearing a mask. So mitigating your exposure to that by wearing a mask can be helpful. And there's been some evidence showing that people who wore masks and had lower viral load end up having better symptoms, like they're not as sick as long, and they don't have really severe issues. We know that people with chronic illness are at risk because of the comorbidity with the COVID diagnosis. And we know that COVID can cause heart problems, lung problems, kidney problems. And that is really where a lot of the unknowns are, where people used to say, like I think I've heard university presidents say, well, we actually don't think our population of 18 to 22-year-olds is really at risk for this virus, because even if they get it, they'll get better and they won't die. So let's just reopen because there's such a low risk population. Now the Big Ten makes this decision to cancel the football season, partially based on evidence showing up that it causes heart problems among healthy athletes who are playing Division I college football. And so we really don't know what the extent of the harm it causes, even in people who appear to be healthy and asymptomatic. And we've been focused on, oh, well, make sure that people over 65 don't catch it, make sure that people in those kind of high risk categories don't catch it. But what we really don't know is what the long-term impacts are. And we have lots of folks who are having long-term symptoms, even though they're no longer COVID positive, they still are showing reductions in breathing capacity, heart problems, other organ problems. So I would be very worried about assuming that we know what the long-term health impacts are. I think we know a lot more about how it is spread and why wearing masks and protecting your eyes can be really important as we kind of reopen and people can't avoid going out in public because we can no longer stay at home permanently.
You know what you said, Dr. Roby, is interesting, but I've not heard a lot of people talk about protecting your eyes. It is, I can see what you're saying. It makes sense that if it go in your nose, it can go in your eyes, and of course, getting your blood system that way, I assume. But no one really focused on your eyes. They just say cover your nose and your mouth. Now, the other thing is that no one's really talked to people about how to wear a mask. I've seen people wearing the mask with it's just over their mouth and not covering their nose. I've seen people who literally take the mask down to talk because that, they seem like that's okay, take it down to talk. And then when they finish talking, they put it back on as if you have protected yourself. And so I think that a mass conversation the masses need to have a mass conversation about how to wear a mask, how to protect yourself, to include not only your mouth and nose, but your eyes. You brought up a salient point. Dr. Chestnut, have we thought about that with the kids? You know, that it can become an aerosol. They're in many times these school rooms that are not very well ventilated. You know, we have many of our instructors are older with comorbidities and a whole lot of challenges. And so I'm curious as to whether or not we taking all of that into consideration.
Actually, you know, just from conversation, we have a lot of teachers, support personnel that are actually afraid. They are afraid of being put in a situation where they feel inadequate to protect themselves or to protect the children because they're not medical experts. A lot of them have expressed concern about bringing things back home to their elderly parents. And then also when you're dealing with little kids, especially your younger ones, they really don't understand social distancing just by nature. You know, before they ever arrive on the bus, arrive at the school building, you have the issue on the bus, you know, with your buses and the close proximity of how the kids are seated on the bus. Of course, we cannot expect the bus driver to drive them safely to school and then monitor whether or not they're social distancing, then check temperatures. And you know, the truth of the matter, you have some parents that are single parents and they know that if I don't show up to work this morning, even though little Johnny has a fever, I've got to put that child on the bus so that I can provide a place for him or her to sleep. And so there are so many variables. And I agree with Dr. Roby when he talked about, do we really know, you know, what's happening? Do we really know how to solve this problem? I know as a pastor, I've come in contact with people that have survived COVID and now they're dealing with the emotional aftermath of having it, you know, dealing with anxiety and depression and just the fear of the reoccurrence of the disease. And so the situation is layered with a lot of questions and a lot of concerns right about now.
You know, it's interesting is that as and I agree with both you, Dr. Chestnut and Dr. Roby, that there's a lot of unknowns, but there are some things that we do know. And I'm going to ask you, Dr. Roby, do you think we need to just kind of level set and reset? Because if we have done this for going on, 6 months or something, like 5 months or something like that, we've not gotten it right, is it time to call a timeout and just say, okay, let's shut everything down and go for a period of time and then see what happens after that? Are we at that point, or do we continue to kind of piecemeal this thing and have each particular geographical location do their own thing?
Right. Well, I mean, I think the U.S. is just built to have geographical locations do their own thing because of our democratic republic, right? So even if a president decided that there are federal levers they could pull to require mask wearing, closure of certain components of the economy, closure of schools, it would actually be very difficult to operationalize that at the state level. So I think we're kind of stuck with states deciding what to do, then localities deciding what to do based on what guidance the governor proposed or what the legislature has done. So I feel like even though in Italy you can shut things down and just allow people to go to grocery stores one day a week, we won't see that sort of systematic approach in the US just because we never take a systematic approach to solving things because of the way our political and governmental systems are set up. I do think a restart is needed from a policy and kind of public health education standpoint. And I think if the federal government stood up and said, look, we gave you wrong information for the past 3 months, these are the things you can do to preserve your health, and we're going to facilitate that for people. So let's say the federal government said, okay, well, we have done an awful job with testing. People shouldn't be waiting 7 days to get test results. People
Right.
shouldn't need to have symptoms to get tested. Instead, we're going to spend a lot of money on making sure everybody can get tested once a week, whether they're symptomatic or not, using the power of the federal government's laboratories to run more efficient processes. And we're going to give clear guidance about how to stay safe indoors, how to stay safe outdoors, how to wear your mask. We're going to provide masks for people. Like, those are all of the things that South Korea, Singapore, and other countries have done well, that have been able to weather this virus in a more, equitable and also a way that doesn't harm people's health as much. But you would actually need a strong central federal government to do that, and we don't really have that in the U.S.
You know, it's interesting. I'm glad that you mentioned that, because I agree that based on the construct of the United States and the autonomy that we give both states and local governments, that becomes very difficult. But it's going to have to come to a point, if we're going to really address this, that we have at least compliance with some system that constrains this disease. If not, we will be dealing with this, and the economic impact of this will continue to linger adversely. Let me, Dr. Chestnut, are we testing these kids, and to what extent are we? And as Dr. Roby said, are they getting the test back in time that is useful?
Well, to my knowledge, I know that they are testing the kids that are going off to college. I have not heard whether or not they are testing those kids that are K-12. I'm sure they may be in some areas, but I do know there is mandatory testing for those that are in higher education.
So the kids in going to the elementary schools and middle schools and high schools, they may or may not be tested, is what I'm hearing from you, Dr. Chestnut.
That's what you're hearing from me.
See, then how do we know? If there are no testing, then how do we know? I mean, that's what and that's a rhetorical question, obviously. But you know what I mean? Help me out, Dr. Roby, Dr. Chestnut. How will we know if we don't test? I heard this, what I think is an absurd notion that we, if we test more, we'll have more cases. That you have heard that, right? I mean, well, the point of the matter, testing does not give you cases. It merely identifies where your cases are, so that you can, trace and isolate and that kind of thing. But when you're waiting, as Dr. Roby said, for a week plus, then you can't do tracing, because people have seen so many people, they've gone too many places to even do contact tracing. So a week that's pretty much a useless test. Am I right, Dr. Roby? And then Dr. Chestnut, you can chime in.
I mean, I think we need to figure out a way to accelerate that waiting period. And one of the problems is, like, even in universities, so as Dr. Chestnut mentioned, I think most K through 12 districts have basically said, there is no way for us to manage re-entry for this population with testing. So either we're going to go completely online, or we're just going to roll the dice. And you see folks rolling the dice in Georgia and Spalding County and all those areas. And we're seeing the consequences of that. A good example of kind of well-meaning, but perhaps a potential failure, is at University of Notre Dame, where they had a very good plan for testing in advance of coming back to campus. And they basically put out a number that said, of the 11,000 students and staff that are coming back to campus, only 0.28% of them were positive. So they basically said, all right, if you're coming back to campus, maybe we have a lot of people coming back, but everybody needs to provide evidence of a negative test within the past 2 weeks in order to have the right to be on campus. So they have people do that. People get tested 2 weeks ago. They deliver the negative test result 7 days later, which is still 7 days before they're supposed to arrive on campus. Then they show up on campus, and within the first week, they had 12% of people who are symptomatic testing positive. So one of the really key indicators that a lot of public health experts look for is what's called the positivity rate. And that's the percentage of tests that are being returned positive. And you know that you're doing a pretty good job mitigating the spread of the disease when your positivity rate is below 5%. My county, Prince George's County in Maryland, has a 5.2 positivity rate, and we're the hardest hit county in the state. In April, we had a 43% positivity rate,
Wow.
which meant that for every test delivered, 0.4 were
almost half.
positive.
That's almost
And
half.
so, right. So the concern there is when you're under a 5% rate, you have a pretty good idea that the number of positives you're seeing is probably close to the number of actual cases in the community. So if you're at 5% and you see that 3% of the population has the disease, you're probably right on. Like there are 1,000 cases a day. If your positivity rate is 43%, that means you're probably miscalculating by about 10 times what the actual underlying rate of disease is. So right now we're looking at these charts that go up and down and show 2,000 cases in April and 2,000 cases now. And we act like they're comparable, and they're not, because the positivity rate back in April in hard hit areas was often 30, 40, 50%. And that meant that there were actually 6,000, 7,000 cases that were going undiagnosed in those areas. So the situation has gotten better because we now have a little bit better testing. But if you are reliant on this delay in tests, you're always playing catch up on that measure, and you're trying to keep positivity rate low, but that's an indicator for if you're missing a bunch of underlying disease out there. And so we need to keep our positivity rate low and our testing rate pretty high, so we are confident that it's a right number.
Well, the point of the matter is if you're not testing, you won't know what your positivity rate really is, right? If you're not testing adequately enough. Is that correct, Dr. Roby?
Yeah, so what we're seeing though, when you see really high positivity rates, that means that only symptomatic people are coming in. So at Notre Dame, for example, they had 500 students show up at student health and get tested because they actually had symptoms. We know that in this population of 18 to 22-year-olds, and then probably in the K through 12 population, most of the cases are actually asymptomatic. They're never going to develop any symptoms, but they could be spreading the disease. And so under that metric, 12% of 500 Notre Dame students showed up the first week of school and had a case. That probably means that probably about 200 cases were on campus, but only 50 actually got tested out of that 500. So we're always, if you have a under 5% positivity rate, you can be confident that the numbers you're seeing being reported by the federal and state government are about right. But if you have a higher rate, you have to be really concerned about what we're missing. And when you're only testing symptomatic people who actually feel feverish or are losing taste in their mouth, that sort of thing, you're missing probably more than half of the infections out there that are carrying the condition.
Dr. Chestnut, we got grandma and auntie and Uncle Jed and all of that that doesn't go to school, but those children come back to those homes and they eat at the table and they play with them and they do different things. We have a different kind of scenario that we have to take into consideration when it comes to people who cannot social distance because of the close proximity by which they live and that kind of thing. And so children can be like a petri dish and carriers back into the community that can impact the community in an adverse way. Have we taken that into consideration, Dr. Chestnut?
That is definitely something that needs to be a priority. When you think about a lot of the home settings where they're in situations where there's only one bathroom in the house, or you may have multi-generation family members in one home, because like you said, a lot of the younger people are asymptomatic. They're not there's no sign or trace of symptoms. And then when you're in a area where if you don't have a symptom, then the chances are less likely that you will even get tested. And so again, it's almost like we're setting ourselves up for a reoccurrence of an influx of increased cases, you know, and oftentimes because you're dealing with a segment of people that are asymptomatic, as you mentioned, they're coming back into the homes. They are coming in contact with other children who have parents that may be first line workers, or they're going into the school settings, not to mention those that are trying to deal with the sports. And I'm still trying to wrap my mind around having virtual learning, but you're still having sports. You're still playing football, you know. And it may be something that's just above my pay scale. It just doesn't add up. A lot of the decisions,
economics, Dr. Chestnut. Sports.
yeah, and it goes back to what
Yeah.
I said earlier. I think a lot of decisions have put livelihood over lives.
Right,
and
right.
Until we get back to the place where lives matter as it relates to this COVID, and that's the main thing, not how much, how many resources we can gather, how much we're going to lose if we don't have this going on and that going on. Because when you look at it, this is a serious, serious matter. It goes back to, and I've had several instances just personally where you have your loved ones in long-term care facilities, nursing home facilities, and they're the ones that's hit the hardest, and they are not leaving the facility. And so there are just so many variables, so many things that we need to really revisit. As Dr. Roby said, it's almost like we need to go back to the drawing board and really revisit where are we and where do we need to go from this point before it gets worse.
You know, Dr. Roby, you made a salient point, and thank you, Dr. Chestnut, for that. You know, because I think that you've hit on a very salient point. You know, we started out and we entitled the program, you know, Science, Not Politics, in terms should be influencing the process. I want to ask you directly, Dr. Roby, do you think that science is leading, or is it more politics? And if so, what can we do about that?
So I think science is leading in certain states that are making evidence-based decisions based on the information available. So there will be, a great example would be these decisions by Maryland, Virginia, and DC to basically shut down and then reopen concurrently when certain measures were pointing the right way. And so they looked at things like positivity rate, they looked at things like ICU beds, and they knew what the underlying burden was in their area before they decided to pull the trigger and reopen. And then you have states like Georgia and Florida where the decision was made to reopen without a lot of evidence when we were seeing rates going up quite a bit, rather than this interest in following the measures and ensuring that they were using science and evidence to empower them to make decisions, rather than viewing it as some impediment that's going to compromise economic activity. And I think, as Dr. Chestnut mentioned, like this argument that public health and economics are at odds with each other is ridiculous. You know, if we do a good job on the public health side and people actually feel safe and comfortable returning to the economy, they will do so. If they feel safe going to work, it will produce better productivity. If we don't have to stagger shifts at manufacturing plants because people need to be socially distanced and wearing masks, we will increase productivity. People will return. And you know, my brother-in-law is a restaurant manager in Singapore. Grew up in Los Angeles, but now he manages a restaurant in Singapore. They've basically stayed open throughout the entire thing. But then if they see just a tiny few bit of cases, they will shut down for 2 or 3 weeks, eradicate the problem, and reopen. And so I think we need to follow that model rather than assuming that we're just going to be shut down for 2 years and accepting that. We need to do a really good job of being aggressive about controlling outbreaks, doing testing, doing contact tracing, and investing the money in the necessary places. I think, you're seeing the politics side in the federal stimulus package that was being debated a few weeks ago, where you have President Trump basically pushing for a payroll tax cut in the stimulus package. It's like, well, a payroll tax will not help unemployed individuals. It will not help, it will just help firms that he is allied with in big business who want to save money. So it's like, it's inherently a wrong-headed solution for a policy problem that's driven by political interests over science. And so we see that all the time in, the federal stimulus packages. So it would be great to see one that came out that actually gave money to individuals who are unemployed for a longer term period of time, gave them breaks on foreclosures and, evictions and all of the things that are actually needed to make sure families are safe, able to, stay away from unsafe situations with their kids related to childcare or their work situation. But instead, we're seeing kind of politics show up in those stimulus packages that really won't help the situation.
You mentioned something, a salient point, Dr. Chestnut, when you said that a lot of parents are going to work because they have to go to work. And even if they know that their children may be a little ill and not know what it is, they are taking a chance of sending their children to school that may expose other children and faculty and teachers with COVID-19. What Dr. Roby is saying is if we are able to take care of people during this time long enough to curtail the spread of the disease, then we may be able to get back to some normalcy in terms of our economics. You agree with that?
I agree with that. You're dealing with so many variables. I mean, just this morning, I had someone to call. They're in dire need of just child care for their infant because out of fear of sending the child to daycare. They're saying, I need someone that can take care of my baby so that I can go to work. Well, this was a grandmother. So can you imagine a single mother or a single father that does not have a support system to assist in this situation? I guess to be honest and to be transparent, I'm having to help my own children. However, they are working from home, but because they have toddlers, 1-year-old, 2-year-old, 3-year-old does not understand mommy is on a Zoom meeting or she's trying to get this work accomplished. And so my thoughts always lean toward that person that does not have that support system. What will happen when that parent has to choose whether or not they're going to eat, whether or not they'll have a roof over their head versus what am I going to do with my son or my daughter? And so there are so many things that extend beyond the health part, just a matter of whether or not we can survive just overall in this situation.
I don't know if you know this right now, Dr. Chestnut, but has the federal government really infused the proper capital within the public school system of Alabama to try to create an environment to mitigate the COVID-19 pandemic? Do you know? Do you have any
sure.
idea?
I know that they have sent some funding. From what I'm hearing, there are different stipulations, but as far as the intricate details of what that money entails, I'm not sure about that right now.
Dr. Roby, there are all school systems are not created equal, right? And so there are certain environments that were not good and healthy before COVID-19. And certainly based on the fact that COVID-19 is present, is not good now. And so the whole notion of having proper air circulation, HVAC systems that are appropriate, that kind of thing, does that have any impact over the spread, as you understand it, of this particular virus?
Yes. So, indoors is probably the most dangerous place to be. So the advice is, use MERV 13 filters in your ventilation or HEPA filters. School districts don't necessarily have the money to retrofit all of their ventilation systems to comply with that guidance. The other option is, you teach with the windows open. So I saw that in New York City public schools, because they reopened, even in the winter, they're just going to leave the windows open because that'll create enough air circulation that they're a little bit more confident that at least virus will get dispersed instead of, being inhaled. So there are all these kind of really basic, maybe unacceptable workarounds that school districts that don't have the resources will be engaging in. And the money that they got from the federal government in the form of the 3 first bills that came through related to stimulus probably doesn't solve anything, partially because these school districts are already funded by property tax for the most part, and maybe some sales tax revenue, depending on how the state works. And so if you have an economic downturn where housing prices are going down, people are foreclosing, we're not seeing as much activity on the sales tax side, and those tax revenues are going down, all the stimulus money is doing is potentially plugging that hole in the budget. It's not really freeing up resources to fix the things that are needed to be fixed in order to make things safe. So I think, and the other thing is those allocations were made based on a formula that probably does not appreciate the unique settings and situations that different school districts and different schools within those districts are in. So basically the federal government calculated the formula and sent out the transfers without really saying like, oh, does this school in a higher income area need this amount of money when this lower income school that could really use help would need more, and correctly allocate those resources.
Wow. And all of that makes sense. I often, you all are really giving really good information. And I wonder how much do you all collaborate? I'm talking about universities, Dr. Roby. Are you all kind of putting your heads together and coming up with policy proposals for government? Because government, oftentimes, they don't know what to do, but they try to pretend like they do, right? So that they can look like they're in charge, right? Right? So are you all working together? Are you all putting information to the school boards so that they can at least operate with information so that they can make informed decisions about reopening or not reopening? I'm wondering what level of collaboration is taking place, or are we operating in silos?
So I would say there is information coming out of universities that are very skilled in these types of pandemic responses. So Harvard and Johns Hopkins have both put out really good guides, and the Harvard guide is pretty good when it comes to K-12 education. So it basically has kind of a list of all the things you have to be worried about as a K-12 administrator. And it provides a basic plan. However, it relies a lot on county and local support. So like it'll talk about testing and why contact tracing is important, but then the school making that decision or school district making that decision is reliant on the county public health agency to be able to have the capacity to do testing and tracing for all their students. So there is that disconnect where school boards and school principals and leadership may know the best practices, but they may not have a way to operationalize it because their local government is falling short in some ways. Universities, University of Maryland, for example, has been working with probably 4 or 5 counties in the area around modeling what their demand for ICU beds is, what based on kind of the spread of disease. So we're doing this more proactive modeling to try to empower county health officers to make decisions about closure and where their weak points are. And at the same time, we've been working with the county to figure out how to reopen the University of Maryland College Park, because the county is going to oversee, whether we get shut down again if there's another disease outbreak. So there is this collaboration that goes on, but I would really look for K-12 administrators. I would rely on the Harvard K-12 readiness guide, which is pretty good, but it still requires you as a school board member or administrator to go ask your county health department questions about, can you actually support us in doing X, Y, and Z? Because if you can't, that makes our plan to reopen untenable.
You know, I'm interested in knowing, Dr. Chestnut, have you kind of evaluated and looked at the plans for the various counties in your district, and do you see any synergy around those plans, or are they kind of just all over the place?
Well, like I mentioned earlier, each school district was given kind of a roadmap, if you want to say, of the minimums of things that needed to be included in the guide for reopening. You know, I live right here in Selma, Alabama, small rural community, and we have two different school systems that have two different plans. We have one system, they're going totally virtual. We have one school system right here in the same city where some of the students will go into the building and others are staying home. And so there's no continuity, you know, across this area. Each school district basically did an assessment and came up with the results that they thought would best suit them. You know, Dr. Roby mentioned earlier about all things were not equal. There's not an equitable formula here, because when you look at the fact that the schools here in the Black Belt were forced to go remote, a lot of them were in areas where they had no internet accessibility. And so the funding that may have been issued to them is now being used so that they can secure hotspots. And when I say hotspot, that it goes as far as sending buses with a hotspot so the parents can you know, at least have some sense of gaining access. And then the concern now is, do we have the parents that are equipped to ensure that their kids can properly use the equipment? And so in this situation, using the formula that what we call equal, again, is not equitable, because you have areas that have greater needs than others. And so like I mentioned earlier, there are just a lot of concerns that we're faced with right now.
You know, Dr. Chestnut, I'm concerned about special needs children. That particular notion of using the internet will not work for them. Have there been any special attention to address the issue of special needs where remote learning is just not, you know, it's just not possible?
I do know that even during this pandemic, the IEPs are still in force, where the parents and the school districts are having to come together to ensure that their child's accommodations and modifications are met.
When you say
I can say
IEPs, you know, you can't use acronyms, you know,
the
on radio.
individual educational plan.
Yeah,
I'm
okay,
sorry. I'm
you know,
sorry.
you know.
I'm sorry.
I mean, you go way over our heads.
I'm sorry. I'm sorry. So I do know that those things are being implemented now because they are individualized. You have kids that have varied needs. I do know that resources that are available are taking the extra measures to meet those kids' needs. But again, there are some situations where, even if they're not special needs, where you may have students that may be challenged academically, they may be a couple of grade levels below, they may or may not be able to benefit from the virtual learning. And so we're in a situation where people are pretty much doing, I guess, the best they can with what they have. We're just, my concern again, as I mentioned earlier, about the kids that have the greatest needs. They're the ones that will probably be impacted the most. And so, but I do know by law, they are having to still maintain those requirements that align with special needs students. They are doing that.
Yeah. Dr. Roby, I want you to pull up your crystal ball, and I want you to kind of tell me, what do you see in the future in terms of COVID-19? And then what do you think we can do specifically as a nation to try to make those outcomes the best that they possibly can? Kind of give us your vision for this.
That's a tough question to end with. So I think wear a mask is really important. The evidence points to mask wearing as being incredibly helpful. And there are cases in which people who are COVID positive were living with their families, had a mask on, and the other members of the family were able to avoid infection. So I think we should not undersell mask wearing. And I think that means that we need to focus on ensuring that all states and localities have a mask mandate, and that the guidance is really clear about when you need to wear them, especially in indoor settings and when you can't social distance. And, I worry about all the fatigue that people are feeling around being stuck inside, having to go to work in stressful situations, wearing masks and PPE, but also just getting poor advice. And so I think we do need to figure out a way to provide guidance that is not as heavy-handed and places responsibility on specific parts of the population. Like, I don't like the idea of shaming college students for going to parties when there are adults out there also going to parties. So I think we're going to reach some new normal where, until there's a vaccine, if we have this under control, you should get used to wearing masks all the time indoors, most of the time outdoors when you're going to be in close contact with people, limiting your engagement a lot, getting tested very frequently. If you're in an essential worker category, maybe getting tested every 2 or 3 days. If you're somebody who goes out once in a while, getting tested once or twice in a month, so that we actually have an idea of what's going on. And I think that would allow our economy to reopen and a lot of the safety issues to be dealt with. Because I don't think a vaccine will be really ready for prime time and able to be rolled out to the broad population until probably late in 2021. So we're probably in for another year of this if we don't take action to kind of mitigate spread now. Of course, there are countries like New Zealand, South Korea, Singapore that are kind of weathering outbreaks as they come, but their numbers are a drop in the bucket compared to what we see. And they've been able to do it through public health and mask wearing and strategically shutting down when necessary, so that everybody's not stuck in this state of economic downturn and fear. Instead, they're kind of able to phase in and out. And I think if we do this successfully, that will be our world for the next year. If we do this poorly, it will get worse and worse because, in states like Texas, Arizona, et cetera, where the disease spread has been pretty significant, that problem won't go away. We'll just continue seeing these big outbreaks in specific localities, and it'll kind of move around the country until either we have herd immunity or a vaccine comes available.
Yeah, Dr. Chestnut, I'm going to ask you in a very short way to capsulate, in terms of educationally, what would you like to see, and how do you believe we can get to that space?
Well, I would like to see all of our children tested, so that we, if we're not tested, we really don't know what we're dealing with. I would also like to see adequate funding for those school districts that could not meet the requirements prior to, whereas one school district that may have had one-to-one technology devices for every student, the money that was sent down, we're trying to purchase devices so that every child can have access to the internet. And so as a result of that, we're still not able to provide the support and the resources comparable to other school districts that were already internet and have technology access. And so again, the disparity in the sources and resources are increasing rather than decreasing. And we're seeing the results of that. I'm concerned about the students academically that were already challenged. What are we going to do to narrow that gap during this pandemic? And so definitely we need to go back to the table and really revisit what is this going to look like. As I listened to Dr. Roby say, we're talking another year. What we're talking about here in Alabama, basically, most of the plans have been based on a 9-week plan. And so we've really got to go back and revisit where we are and where we need to be so that we can minimize the spread of COVID, especially in your high poverty areas where the numbers are continuously rising.
Okay. Well, thank you all so much. Let me tell you this. We have done a whole hour, and the time has is nigh that we say goodbye to our listening and viewing audience. Thank you, Dr. Roby, as well as Dr. Chestnut, for coming on and sharing such valuable information. I'm smarter as a result of having you on the show, and I'm sure my listening audience and viewing audience is as well. Thank you all for being a part of the You Got the Power show. I thank you again for all of the prayers that you have sent my way and to my family as we get ready to put my mother to rest on this weekend. This is going to be a private graveside service only for the immediate family due to COVID-19. And so therefore we cannot have people there trying to protect everyone and operate within the parameter of our reality. So thank you all so much for everything. We're going to get through this together. We'll be back next week, same time, same station, to talk about voting. And we're going to take voting all the way up to November 3rd. We're going to be doing something on voting each and every week, all the way up to November 3rd. As always, I'd like to thank you for your support. You can send your checks and money orders in care of You Got the Power, P.O. Box 146, Tuskegee, Alabama, 36087. Also, you can check us out on Facebook and go PayPal or Cash App to support the program. As always, I'd like to leave you with these 2 words. Remember that I love you with a perfect love. But more importantly, remember this. You got the power. We'll see you next week, same time, same station. Have a wonderful day. Bye-bye.